Welcome back, everyone. Thank you for joining me this week with Story Time with the Disease. And this week, we have a real treat for you. We actually have Syphilis Diary. Shall we get started? August 1494, the Italian War. No one really knows who I am, and I kind of like it this way. But seeing all those soldiers coming to Italy in preparation for war makes it all too tempting. Rumor has it King Charles VIII of France brought 50,000 men to take over Naples. This could get fun. February 1495. Sorry about the hiatus, diary. I've been caught up in my typical activity with ladies of the night. Since King Charles's men have been around, things have been super busy. These men celebrate all night. March 1495. They know. Well, they don't know exactly who I am or what I'm going to do, but they are starting to realize what happens in Naples doesn't stay in Naples. September 1497. Everyone knows who I am. If you live in France, Switzerland, Germany, England, or Scotland, you do. Want to know the worst part, diary? The names that they're calling me. The French keep calling me the Spanish disease, the disease of Naples. The Germans are calling me French evil. The Russians even call me the Polish disease. And the worst name? Parisian fire. Really? Evil? Fire? At least give me a good name. I'll keep you posted on my name diary. Fingers crossed they pick something pretty, like the flower or the ocean. One night later, I met a guy tonight. De Morbo Gallicus. He was nice. Unknown diary date entry. Who does he think he is? Sorry, diary. Some fella, Juanes de Vigo, an Italian surgeon appointed by Pope Julius II, thinks he knows who I am. Apparently that quote-unquote nice guy let the surgeon study me. Did he get consent from me? No. How rude. And get this. This is what he's calling me. Sexual intercourse infection, canker, rash, ulcer, night bone pains. Does De Vigo not realize I am more than that? What about my stages? 2 days later. Dear diary, sorry for yelling at you last time. You're just the only way I can express the way I feel without giving myself away. It is kind of fun watching them do this guessing game, but sadly, De Vigo was right about one thing, my primary stage. I guess canker is a good word to describe my welcoming sight. Little do these people know where the canker is exactly where I enter the body. Touch genitalia, canker. Lip, canker. Tongue, canker. Before you go feeling bad for this guy, the canker is not painful. It's usually small, firm, and round. Want to know something funny? It doesn't just have to be sexual intercourse that causes me to spread. You can get me from touching something that touched a canker. That's how good I am. And I don't just come from men either. Women can get me too. And I'm not a little bit bashful. I don't mind being on the body where everybody else can see me. Okay, that's not entirely true. I suppose I do go and hide after a few weeks from this contact. One of the best part? It's not just hiding. Surprise! I'll be back in about 6 weeks. Around 6 weeks after meeting quote-unquote nice guy. I'm not very good at hiding. It's just too boring for me, diary. So I decided to give Surgeon De Vigo something to look at and Mr. Gallicus a little reminder of myself. I won't give many hints, but I do like to call this my secondary stage. Little do they know, but this is actually when I'm most infectious. Be careful, little Gallicus. Remember how Surgeon De Vigo was trying to call me a rash? He wasn't 100% wrong. I just prefer diffuse eruptions to skin. You know, like rough, reddish spots, typically on the bottom of your feet or the palm of your hands. Sometimes I can feel scaly, but I have a smooth side too. But I like to be seen this way. But how fun would it be if I only erupted on the skin? Not fun for me. Did I mention Gallicus may find me in his mouth? Oops. Yeah, those are usually on the tongue, lip, buccal mucosa, and the soft palate. These can be called ulcers or mucus patches with irregular whitish edges. These ones might hurt. Sadly, when I go through the oropharynx route, I can give you a sore throat too. I mean, don't complain. I can keep going. Swollen lymph, headache, fatigue, loss of appetite. They really should be thankful I don't give it to them all. 1 year later. Quote unquote, provoke terrible suffering. That is what Surgeon De Vigo is saying now. Are you sure that Gallicus isn't just making this up and he's a little bit of a wimp? Okay, actually, he isn't. It's not. It's my fault. No one knows how to treat this, but I'll admit, this phase isn't my most pleasant. He wasn't always quote-unquote suffering. Can I make that clear? I gave him a latent stage, a little break, like a little remission period, trying to make me look bad. Chill out, Gallicus. But, just like clockwork, 1 year later, give or take, I am coming back. Ta-da! Tertiary stage. Something I like to call guma is the lesion that makes an appearance at this stage, but unlike my other lesions, this one is not infectious, just ugly. It can be seen on the oral cavity on the palate and the tongue, like a firm mass that becomes an ulcer. And if you let me fester long enough, I'll perforate your palate bone. Did I mention how strong I am? So no one else knows this yet, but sometime in the future, we'll discover this, so I'll just tell you anyways. Neurosyphilis, cardiovascular syphilis, and late benign syphilis are related to the involvement of the CNS and will spread in this tertiary stage. Long story short, I guess I'll make people crazy. Dementia, psychosis, delirium, and I can cause some serious complications to other organ systems too. Okay. Now I just want to make this clear. Right now, this stage is a lot more common in 1498 because nobody can figure out how to outsmart me. So, hello. Find a scientist, discover some kind of cure, and nobody will have to deal with this horrible part, okay? And P.S. Diary, no name still. Fall 1528. Apparently, people are fearing my tertiary stage due to the disfigurement I cause and the social outrage that follows. People are saying that I'm a sign of sin, and people are being shunned, punished for having me. Can you believe that, Diary? Shunned. So I guess they kind of figured out exactly how I get spread. Just because you have this lesion all over your body, this is how people were treated? Huh. People are really knowing how to make me feel like some kind of venereal disease these days. Spring 1530. I have a name. Ready for it, Diary? Syphilis. Yeah, all that time for nothing. Some guy for Carstro wrote a poem called Syphilis on the French disease about me and decided that's what I get. Now here's what I don't understand. This poem was filled with mystical creatures and kings, and all they could come up with was syphilis. That even makes me feel gross. 1530, sometime later. Well, I can't decide if this fat for Carstro guy is smart or not. He claims he found a treatment using guaiacum, the holy wood, a herb made from the bark of trees in the Caribbean and South America, with the treatment of mercury. A tree? Really? If you want to get rid of me, you have to try harder than that. And mercury? I'll just let you guys figure that one out for yourself. 1761. How do these people not get it? They are trying to compare me to gonorrhea. Gonorrhea! How rude. I am obviously far better than that disease. More stages, more severe. I can go on and on. If I get compared to gonorrhea one more time, Diary, I swear, I've never been so appalled by these people. Actually, hint the name. It's pretty bad. 1838. Hallelujah for a little bit more modern medicine. And hallelujah for Felipe Ricord. He finally confirmed that gonorrhea and I are not the same disease. Finally, someone around here gets me. 1861, London. Diary, what I'm about to tell you is something that I'm not proud of. It just comes along with me being me, okay? Congenital syphilis. Dr. Hutchinson has discovered me. So I'll tell you how it is, Diary. I have nothing to hide anymore. So say a mom has syphilis and gets pregnant. I have the ability to spread through the placenta to the infant and, well, giving the baby me. Worst part about it, half of the children born will die shortly after birth. And if they don't die, I give them a birth defect called mulberry molars or Turner tooth. 1913. Joseph Waldron Moore and Hideo Noguchi? Remember these names, Diary, because these guys are finally getting smart and using their 19th century medicine ways. They have figured out exactly what I am, which means that it's only time before they find my cure. They are saying that I'm a spirochete pallidum, later known as a Treponema pallidum. I don't know if either is good, but let's be honest, both are better than the name syphilis. 1940, World War II. So you're telling me this is their second World War? I really don't get these people, Diary. All these people are worried about is not to cause a manpower deficiency like I caused in World War I from venereal diseases. Apparently, soldiers weren't supplied with condoms, and this was the second most common reason guys couldn't go on to duty. 7 million lost person days and 10,000 discharged men. Really? You have to warn people like this? But thanks to me and the new statistic from this year saying that 64,000 Americans have died because of me, and I am the 4th leading cause of death in the U.S. 1943. My cure. Well, if you decide to use it, it's arrived. Penicillin. Up until now, they've been using an arsenic in combo with bismuth or mercury. And let me tell you, this treatment worked, but I have a feeling penicillin will be a little bit better for people as a whole. And not only treat me, but maybe cure many more infections in the future. Apparently, they say a single intramuscular dose of penicillin G will just do the trick and kill me. Or doxycycline if you're allergic to penicillin. They're saying that even by doing this dose every week for 3 weeks will even terminate me in my tertiary stage. I can't admit my death. I'll continue to hold out for the people that continue to have unprotected sex and continue to spread me and be lazy and not get treated. Long live syphilis. Long time later, early 2000s. Still here, just not meeting as many people these days. Only about 46,042. And yes, Diary, I'm going to tell you every single one. Apparently, they now have a way to diagnose people, because apparently my lesions look like other bacteria. Who could be me? No one. Dark field examination of a lesion is used to identify spirochetes, but this isn't reliable. So now they're choosing to stick a needle into people's arms for a blood test. The first one being the Venereal Disease Research Lab, so VDRL. This test either says I'm there or I'm not, but can't distinguish if I've been treated before or not, so it has a lot of false positives. Fluorescent treponemal antibody absorption, aka FTA ABS. Want to know why this test isn't either great? Takes 4 to 6 weeks for a positive test result, meaning you'll have my primary stage before you get your results. So, what doctors are apparently doing now is they're doing an FTA ABS test and then the VDRL, hoping that by doing both of these tests, they'll rule out my sneaky primary stage and get more of an accurate positive result. The problem, though, is if you've had me before, you're going to say positive again. 2014. Wow, I'm old. The FDA approved a finger prick to do a rapid 15-minute test and will give the penicillin dose to hopefully terminate my development. Modern medicine is not my friend. Okay, guys, so now in like this odd chance somebody wants to go get their teeth cleaned and see a dentist, you can. It's just important for the dentist and the staff to really understand me and be familiar with all my oral lesions, okay? By understanding the patient's history, a physical examination, and completing a differential diagnosis can not only help diagnose me, but play a role in treating me. I don't want to be treated, but we'll give them it, okay? Patients are not required to take a pre-med, but caution should be used because I do most commonly show up in immunocompromised patients. And just like any other oral lesions with my other friends, if I'm open, don't treat me. Wow. I don't know about you guys, but syphilis seems like a lot to handle. Well, that was our last diary entry, but hopefully there will be more in part 2. Until then, hopefully they find a better cure and a way to treat and diagnose.